Hello, I'm Dr. Yasser Janab, interventional cardiologist from Tehran Heart Center, presenting the topic Cardiology in Practice series. In this session, I'll present orthostatic hypoxemia after device closure of ruptured of Sinus of Valsalva or Platypnea Orthodeoxy Syndrome. We had a 50-year-old woman with ruptures of Sinus of Valsalva with fistula from right coronary cusp to right atrium. The fistula was closed percutaneously with a PDA occluder device, as the video shows. Before the procedure, she had normal oxygen saturation. However, following the procedure, the patient reported severe dyspnea during walking. Also, she had hypoxemia at rest with oxygen saturation of about 87%, which decreased significantly during standing, low to 81%. As another point, she also had a patent Foramen Oval on transesophageal echocardiography. The patient was diagnosed as Platypnea-orthodeoxy Syndrome. This syndrome is characterized by both dyspnea and arterial desaturation or orthodeoxia in the upright position, with improvement in the supine position. You can remember platypnea as it is opposite of orthopnea. Two components are required to diagnose Platypnea Orthodeoxy Syndrome. One is an interatrial shunt such as PFO or ASD or intrapulmonary shunting, and the second is a functional component that promotes abnormal shunting when the patient rises from a recumbent to an upright position. This could be mediated by deformity in the atrial septum and or the right atrium that increases streaming of blood from the inferior vena cava through the defect. There are several causes that result in interatrial septal deformity, as precardial effusion, constrictive pericarditis, emphysema, or pulmonary toxicity due to amiodarone or pneumonectomy, and cirrhosis. So you have an interatrial septal defect and an abnormal orientation of this septum, which directs the flow directly from IVC to left atrium, and this will cause hypoxemia, which when the patient stands makes the condition worse. And as the patient has somewhat hypoxemia during sleeping on or when she or he is lying, but this hypoxemia will be much more worse when he or she is standing, and the oxygen saturation will decrease significantly. And back to our patient. Our patient had a systemic saturation when lying of about 87%, systemic saturation when standing 81%, and she also showed failure of correction of hypoxemia during 100 oxygen tests. And the patient bring back to cath lab to make sure about the diagnosis of Platypnea Orthodeoxy Syndrome and then correct the defect. In cath lab, as you see in the video, measurement of pulmonary vein oxygen saturation was 97%, but left atrium oxygen saturation was about 87%, which shows normal function of pulmonary system and significant shunt in the level of the left atrium. As another test, as you see in the second image, with the balloon closure of the PFO, the systemic saturation increased to 97%, which confirms that PFO has a significant role in the desaturation of the patient. Intracardiac echocardiography used for PFO device closure. However, PFO device deployment resulted to moderate residual contrast shunt, and based on balloon sizing, an AC device 40 mm deployed to close the PFO, and followed the procedure, systemic saturation increased to 95% during lying and standing. In this video you can see the ICE catheter or intracardial echocardiographic catheter for intracardiac imaging. You can see the device used for PFO closure, and you can see the device used for closure of rupture of Sinus of Valsalva.